Hello, everyone. As Evelyn has said, I'm Jeremy Thacker, Director of Government Sales at UberMedia. My team works with federal, state, and local governments, both in the U.S. and internationally, as well as research organizations and NGOs. Those organizations use our data to find creative answers for complex issues. And at the moment, there is no issue more complex than the coronavirus pandemic. In response to COVID-19, UberMedia is dedicated to deliver mobile location data sets that will assist in answering critical epidemiological, resource planning, and economic questions. We hope this will help power crucial decision-making regarding the pandemic. One area we have been working on side by side with those on the front lines is to apply our data to mitigate the effect of the virus on vulnerable populations. So to discuss a specific project in this area, one of our top data scientists, Nathalie Blume, is here today to present her methodology for identifying where homeless populations congregate, how they move throughout the city, what officials in the public sector could do to better allocate temporary shelters, medical supplies, and public health messaging, and many more things to reduce the impact of the virus on the homeless community. Nathalie is a data scientist and machine learning expert with over 20 years of experience working in public health. She's worked in health insurance, academia, several hospital systems, and for the County of Los Angeles Department of Mental Health. Nathalie, thanks for sharing today.
Thank you, Jeremy. I want to start with an overview on homelessness in the County of Los Angeles. Last year, over 50,000 people were homeless on any given night in LA. Most of those, 4 out of 5, were unsheltered. Perhaps unexpectedly, 94% of them had a cell phone and 85% used that cell phone daily. For our purposes, the meaningful figure is that over 50% used a smartphone, which gives us the ability to use mobile location data to analyze this community, like many of the other communities we've gone over today. Since the pandemic hit LA a month ago, the services that are in place for homeless Angelenos have been disrupted. Conveying food, clothing, and data to and from shelters has become more challenging than it used to be. Even the location of services has changed. New emergency homeless shelters have opened at recreational centers and elsewhere, changing the footprint of the shelter system. Shelter parking lots are increasingly used by homeless people who sleep in cars and use shelter facilities, expanding the local area that those shelters oversee. From a management point of view, mobility data can act as a supplementary source of data that helps homeless individuals continue to receive the services that they need wherever they are. And that helps local governmental agencies and others plan the distribution of resources to shelters and other points of service. The first part of UberMedia's work around homelessness was to develop a method to identify devices that moved with the homeless population. To do this, we drew boundaries or geofences around homeless shelters and known homeless encampments like tent cities in and around LA County. Then we did some filtering to isolate those devices seen between 6 p.m. and 8 a.m. and that had other characteristics of use. This ensured that those providing services to the homeless, kitchen workers, mental health counselors, etc., were excluded. A large number of the geofences we used are located in what is known as Skid Row, which is a closely spaced set of shelters and encampments in downtown Los Angeles. Our geofences were also located elsewhere across the county. In all, we used 43 shelter geofences and 11 encampments. All were known to be sites where homeless Angelenos stayed overnight before the pandemic. Once we were confident in the soundness of our method for identifying a set of devices that's owned by the homeless community, we were able to study its patterns of movement. This helped us to better understand how the pandemic is affecting the movement, the location, and the behaviors of the devices. We analyzed the movement of homeless devices 4 weeks before and 4 weeks after March 16. For reference, on March 16, Los Angeles County's major public school systems suspended in-person teaching, causing many students and their parents to stay home. And on March 19, Los Angeles' mayor and the governor of California issued a safer home order, calling for closure of non-essential businesses in Los Angeles. This was a watershed moment in the middle of an otherwise gradual immobilization of the general population of the county. The first map here shows where the devices we identified as belonging to the homeless community were located on or before March 16. Darker colors indicate a greater number of devices within a unit area. The blue and green markers are for shelters and encampments. As you can see, there's a lot of activity in and around the downtown LA area, especially around Skid Row. There is also activity along major public transportation arteries that link downtown LA to the southern and western parts of the county where medical points of service can be found. Those are highlighted with large open ovals. It's interesting to note how much dispersal we see in this map, how far these devices are traveling back and forth between various neighborhoods. Like all Angelenos, homeless Angelenos are very mobile. Now let's compare this to the post-stay-at-home map. We see that the dispersal has grown much smaller. Major roadways that were highlighted previously have faded, and homeless traffic is now more concentrated in downtown Los Angeles. Let's zoom in on downtown LA. We can really see the changes of mobility. The darker blue points are observed homeless device locations before March 16, and the light blue ones are observations after March 16. Post shelter in place, the movement of the devices is concentrated around shelters. Maybe because many businesses around downtown LA closed, traffic decreased, and homeless individuals had less cause to travel to those now quiet areas. This is critical to understand because the increased concentration has the potential to make this already vulnerable population even more susceptible to becoming a COVID hotspot. As individuals group together into a smaller geographic area, they have less opportunity to practice social distancing. Now, one interesting finding is a drop in device activity in the shelters and encampments that we've studied. There's a drop in device activity throughout the day, and there's a particularly steep drop in the activity of devices that stay overnight at shelters, which is shown on this graph. This graph shows the number of devices that stay at least 3 hours inside one of the 43 shelters in blue or one of the 11 encampments in brown on any given day, and that were active late at night. It's a kind of daily census count, a count of how many people spend the night at a location. And it's the result of a computation that helps us determine a shelter's stay with corresponding start and end dates. What we see is that the census count across both shelters and encampments has been dropping steeply and steadily. Now the next graph here, this shows the details of the arrival and departure flux of encampments on the left and shelters on the right. The arrivals are in brown and the departures are in blue. You can see peaks in the number of people who end their stay and the absence of a corresponding peak for arrivals, indicating that these people are not being replaced. The question is, where is the missing homeless population going? Our data can help analyze this as a next step. Without knowing yet for sure, we have several hypotheses. Shelters may have reduced their available beds to encourage social distancing inside the shelters. Sidewalk encampments may be disappearing or at least reorganizing. And new shelters that we did not capture in the graphs, but that the maps would capture, may be attracting residents leaving other shelters and encampments. The devices may also be behaving differently during the day, spending less time in shared spaces within facilities that offer homeless services other than shelter, waiting in socially distanced lines for meals or other necessities, all of which may be decreasing foot traffic in shelters. So bringing this back to a county level, we feel that mobile data can be very instructive to gain an understanding of the movements and behaviors of the homeless population in this time of pandemic. Specifically, the data can document large-scale changes in the geospatial distribution of this population, for instance, by mapping the new footprint of the shelter system or measuring social distancing with or among likely homeless devices, something we'll talk about later in the presentation. We can also compute census counts of given shelters, including how many homeless devices arrive, leave, and are turned away, and where they end up. And finally, we can guide public health messaging to the homeless population. So thank you for listening.
All right, thank you so much, Nathalie, for going over the research that we've been doing on the homeless population. If you want more information on Nathalie's research and what she's been able to further uncover, please let us know. We'll have a contact at the end of this presentation, or if you're already a client of ours, please contact your UberMedia representative.